Mike Todoritis. I'm the Commissioner of Health for the City of Milwaukee Health Department. Thank you all for being here. Wanted to address right out the gate, I think there's a lot of questions and good questions from the parents in particular here in the city about are their students safe in the MPS schools? As we outlined in our letter, as long as MPS adheres to the requirements and the orders that we issued earlier last week, it's safe for the students to be in the schools. And again, some of those cleaning orders require really thorough cleaning and controlling of paint, chipping paint, those kind of measures. And those are the same measures that we use really successfully in all of our residential homes that we investigate on an annual basis. What we're going to do today is walk through the lead risk assessment report. This is a report that we put together again for each property that we investigate if there are identified lead hazards. And as you've been scrolling through and as the parents will see, there's some really high numbers in there, and it's scary to see that. And as a parent of young children, it causes me some reserve when I look at these numbers. But there's tangible things that everyone can do right now to make sure their kids are safe. We outlined those in a letter to the parents of MPS students. Simple things like cleaning their hands before they're eating and obviously washing their hands when they come home, having them remove their shoes at the threshold when they get home to prevent tracking lead dust into a home are simple things that they can do. And also because this is a really serious issue, we issued health orders on 2 schools of MPS, Golda and Cagle Elementary, to ensure that MPS was following through with their commitment to ensure that the students of the school district are safe. So with that, I'm going to introduce Deputy Commissioner Tyler Weber of our Environmental Health Branch. He oversees our lead program and is going to walk through kind of a detailed orientation to the lead risk assessment, and then at the end we'll open it up to take any questions that folks have.
Hi everybody, Tyler Weber, Deputy Commissioner of Environmental Health for the City of Milwaukee Health Department. First, I want to take a big step back and just talk through an overview of the lead abatement process and some parallels with MPS as well as differences and the burden this has put on our own lead program. So the lead abatement process, when we get notified via the state, via statewide database that we have a lead poisoned child in our district, our nurse team immediately calls the family to begin appointments. We try and get in the home within 24, 48 hours, and including with the lead risk assessor, so we can see, 1, start providing education for the family, and 2, try and just visually identify where the lead hazards and do immediate cleaning with a HEPA vacuum. We tape up surfaces, because then we have to come back for a deep lead risk assessment on that property with 2, 3 maybe lead risk assessors, depending on the size and scale of the unit or the home. And then that's usually a half-day endeavor with 2 or 3 people going through collecting dust wipes and then using what's called an XRF analyzer. It's something you can hold up to a wall and it'll tell you if there's lead paint on that surface, even if it's painted over, whether it's a door jamb or a wall or a floor, windowsill, etc. And between the XRF reading, between the dust wipe samples, between visual notes and pictures, and soil samples and water samples, we put together a report that identifies where the lead hazards are. And then normally from there, we create a scope of work to bid out to a contractor. So when we do this, our reports are generally 40 pages. We generally take 30 to 40 dust wipe samples. We take 300 readings per unit with the XRF analyzer. For Golda Meir, this was a massive project, probably the biggest lead risk inspection we've ever done. We had to adjust our processes. We had to use multiple XRF analyzers because there just wasn't enough memory for all the readings we had to take in the building. We took 130, 140 dust wipe samples. That's how many dust wipe samples our lab can normally process in a single week. So we also have to try and prioritize what are the other lead cases that are traditionally coming in. We took over 40 water samples when traditionally we're taking maybe 5 to 10 for a property, depending on the sinks and the sinks that are used for that by that family. So it was a lot of work. We produced then a 140-page report, and that we're going to start walking through today. But on the Saturday that we got into Golda Meir, it took about 8 lead risk assessors 6 hours to fully complete that school, and that doesn't include the report writing, that doesn't include the lab time. all the time that takes afterwards to compile everything, put it all together. So with that, we can start going through the lead risk assessment. So just scroll up a little bit. First, what we try and do is very quickly summarize the findings. Some of the most critical findings are the dust wipe samples, because that is traditionally where that's the main avenue for children to be lead poisoned, is that dust, because it's easily can go on hands and then hand-to-mouth behavior. So another important note, the vast majority of the cases we have are at the ages of 1 to 3. And that is traditionally where the hand-to-mouth behavior is. They're crawling around in the ground, they're exploring the world with their hand, with their mouth, and that's where we just, by default, see a lot of our lead cases come in. So traditionally, lead dust is where we see the most concerning hazards. It can easily get on hands, then you eat a sandwich, and then now it's potentially you're ingesting it that route. So we highlight where the lead dust is found, and you can see the mean average is very high. So as defined by HUD and other federal standards, the average is equal to greater to than 100 micrograms per square foot on a windowsill. The result should be ideally under that. Obviously, the average was 1,600 on the third floor. The floors on the third floor are considered, all floors are considered lead dust hazard, as the average was above 10 micrograms per square foot. And so we advised MPS that you need to treat all hazards, or all surfaces, as a lead hazard. Additionally, if you have a building that is pre-1978, whether that is a home or a school, if you don't know what the paint is, then you should assume it's lead paint. And then the ground floor as well. We found ground floor, first floor, I think second floor and third floor. We advised in our lead risk assessment and the MPS that treat every surface, windowsills and floors, as a lead hazard with dust that is accumulated over time. If we go to page 15, there's an important note on limitations. It's important to note that conditions change over time. So we have to advise this with families, we have to advise this to landlords, that we're going to identify, especially with the XRFs, where the lead paint is, but it's not always realistic to remove every ounce of lead paint. MPS has a lot of paint on their bookshelves, radiators, pipes, doors, walls, and so having that map is really important, and if that lead is still there, then that's going to change over time. So ongoing monitoring of painted surfaces in any building pre-1978 is very critical. And as you'll see later on in the pictures, we saw significant deterioration of the lead paint if you haven't looked at that yourself. And then physical characteristics of the property, we note that in this report. We note on page 15, if you scroll down, we don't have, keep going. We don't have previous notes of, or any indication of previous lead investigations. And then as we get in the interior, we start with in the report with the XRF readings. Again, that creates a map of where the lead hazards are. And then we go into the dust wipe samples, which you can see further down on page 29 are a number of areas that have exceeded the standards out. Not only just the averages, but we have high readings on the windowsills into the thousands, floors in the hundreds. And so what does this indicate? This indicates two things, significant things, and this is what we look for in any property, is what is the ongoing maintenance of the property. You don't have to be a lead risk assessor to go and see that there's deteriorated paint, that there's paint chips on the walls. And if we scroll to the very back end of the report, you'll see the number of pictures that we took. And then also with the dust wipe samples then, is the property, are the optimal cleaning practices in place? And when your dust wipes this high, you're not seeing that. And so you need to maintain the walls and the paint, and then you need to maintain cleanliness. And the trick with lead is that you need to be able to use cleaning methods that remove the lead, including wet mopping. And you can't just use the same mop every time. You have to often throw out what you're using because you might just then redistribute the lead. So lead cleaning is difficult, but it's certainly possible. When you do a good deep cleaning, you can immediately remove a lot of the dust that is there. So that is really key. You can see the pictures, and so we shared this with MPS. We know they did renovation work immediately upon us identifying where the lead hazards initially were as it relates to the lead poison case that we worked with and we continue to work with. It's important to note too, when we're working with a child that is lead poisoned, we can't just fix the property and just say, okay, we're done, we did our job, and walk away. It's actually under state statute requirements for us to continue following the child. So we often work with families 12, 24 months or more to make sure that lead levels have dropped below a certain threshold. And so if those lead levels aren't dropping, we, from the start as well, have to look at supplemental addresses. So do they go to the weekend at grandma's house? Do they go to daycare? So after interviewing the families, working with them, sometimes a new address comes up a few months down the road, whether they move or, you know what, I forgot to share this with you. It's a relationship building that is really key and really critical. And so over time we find out where the lead hazards, one, in their immediate home is the primary concern, but then we have to look. So on average, for the cases that we work with, there are 2 addresses associated with each child. And so I say that to say, because one of the questions might be, you know, have you been looking at MPS schools before? If we had a number of cases where the lead levels weren't dropping, it would lead us to the schools, but it hasn't. But of this year, as we start to flag it more, we have to be more proactive and change our processes to begin looking at more schools, because potentially maybe the lead levels could drop faster if we change our practice. And so we are looking into that. But previously with the lead cases, we have been able to get, we get our lead levels to drop, and we consult with the state. And so this is a new flag for a lot of us to continue looking at MPS schools for the children that are older that come through our program, especially special needs children as well, because they often maintain hand-to-mouth behavior depending on what the needs are and the behaviors are throughout the lifespan. So with that, I don't know if I have more notes. We did take water samples as well. We took 40 water samples, or from 40, took more than that. We take multiple samples from each water source. We know MPS has a lead and water plan. They have filtered drinking water stations across their school. We did find elevated water at 3 wash sinks. So we're providing recommendations what to do there, better labeling, awareness for teachers and staff. Let's make sure that students aren't drinking out of that water. And so we are taking water into consideration here as well. And due to the dust wipe samples, that is our primary concern. But again, we're not ignoring the water. So any questions, I'm sure there are, on the lead risk assessment, the process, what we're finding in the schools, et cetera.
So if it seems like the lead hazards were pretty widespread in the school, does that suggest to you that the district had not been updating this building or cleaning this building as they were saying they would?
It's hard to get this level of lead and dust wipe samples if you have good lead safe cleaning practices.
So what does that say about the lead assessment team within MPS? I mean, I know when we had that news conference a couple weeks ago, there was a lot of emphasizing that these are people who are state certified. They go through all these like processes to get their roles. What do you think needs to happen in that space if this was the current team that was certified and somehow levels got to this point at Golden Mayer alone?
Yeah, so there's a very good question. There's a few layers to lead certifications at the state. One, there's lead risk assessments, lead risk assessors, which we have, all of our inspectors within the lead program have to have that. And that is a state certification. Then all the contractors that we work with to hire out also have to be lead safe renovators, and they must have a lead safe supervisor, because there's a different skill set for monitoring the work versus actually doing the work. And that's really critical. We have seen that MPS has 2 lead risk assessors on staff. So one recommendation that we have in our letter broadly is to reassess who are your lead safe renovators, who are your supervisors, who are your lead risk assessors, and increase those numbers to get back out in your schools and do more inspections and have a better pulse on what is happening in their buildings, because we don't have that capacity. Again, it took us a large number of hours with multiple staff for a single school, and we have a caseload that we also have to maintain outside of this. So it is a recommendation for MPS to consult with the state, to consult with DPI, do what they need to do to increase their capacity to get a better hold of lead in their schools.
I know you had mentioned that as long as MPS follows the guidelines outlined in
Yeah.
the letter, these buildings are safe for students. Are you seeing MPS follow these guidelines, and what happens if they don't?
Well, the concern and urgency is to have MPS move swiftly and quickly as possible. The concern is that this work wasn't maintained on the front end. We are seeing them respond to our orders and respond to our orders for Golda. We expect them to move swiftly and rapidly to do the deep cleaning, to work on Kegel School, followed by Maryland. That lead risk assessment is occurring this weekend. And so we are seeing responsiveness to the schools that we are monitoring.
It sounds like the key is the maintenance to keep it clean, right?
Maintenance is critical for all lead poisoning cases. This is why we have to educate our families. This is why we have to educate landlords. You can control the surfaces, but you need to keep a clean house.
On the accountability piece, when do you test again in the future? I mean, when
Yeah.
will we know?
Yeah, we're monitoring. We're sending teams back in Friday just to collect some initial dust wipes, maybe 5 to 10, just to see how cleaning is going. But on every single property that we have orders on, we have to do a clearance on the back end. So once work is done, we can't just say, cool, you did the load renovation work, we go away. We have to make sure the that's called clearances and the randomized dust wipe samples to come back below the thresholds. So we expect to be collecting more dust wipes then next week.
Are there concerns that maintenance wasn't happening at other schools since this is the result of Golda Meir?
We don't have visibility on that. Again, we found positive dust wipe samples now in 3 schools. We'll see if our investigations take us to more schools, but we know the practices on the front end weren't maintained for these 3.
Can you clarify, so what specific steps has MPS taken since, these pictures were taken on January 18th? I mean, have they painted over these surfaces? Have they done a deep clean? Like, were there,
We know around the 10th they did some initial renovation work in a bathroom, and then we're being told that this week they have a contract with a company locally to do deep cleaning on Golda. I need to find out what's happening at Kegel. That may be happening there too. I'm just drawing a blank, but what's happening with other schools, I don't know.
And so how do you know that it's safe for kids to be there if you're seeing lead dust levels at these levels? Does that make sense?
Yeah, so they have been cleaning. There are concerns for safety as we identified in the letter. And so this is why our orders, if you read into it, we have them, some of the orders are within days to do this work. And that's what we have authority for. And so that's why I also sent out advisory to parents and staff for cleaning practices. What semblance of control do they have for hand washing, potentially cleaning? Teachers can have control of cleaning their own desks. They already have heavy workload, but just to share what actions can be taken by individuals and then what actions need to be taken by the district as quickly as possible. But yeah, we have identified safety concerns on the front end.
And why not, why keep the school open? Like, the health department can shut down someplace that isn't safe, right?
We're exploring that authority with the city attorney. So we've executed our authority as best our ability up until this point, and we're consulting with DHS, and we're consulting with the city attorney if there's more that we can do, because that's a question we've been talking about ourselves.
what would a change in practice look like? I know last week it was mentioned that you really don't, you kind of follow where the sick child takes you, right? Like that's kind of your guys' game plan. But we know 85% of MPS buildings were built before 1978. So what practice are you guys looking at to possibly change?
Oh, for our own or for MPS?
For your own.
So this is a constant debate even before MPS, because we know that there are over 1,000 children poisoned at 3.5 micrograms per deciliter and above, and each year, and we have the capacity to work with children at 15, maybe 10 micrograms per deciliter and more per year in terms of nurse case management, in terms of the funding to do the inspections, to do the renovation work. And so our capacity is largely maxed out already, even at 10 micrograms per deciliter and above. And so there's a really important debate within Common Council, with the mayor's office, with the city of what can we do to get ahead of this? And we're just trying to keep up with what we have. And so, yeah, it would be great to get out there and inspect all 200,000 housing units built pre-1978, but we don't have the capacity to do that. And so the city and that beyond government needs to work collectively for more resources to urgently get ahead of this in our homes, in the rental units, and now adding visibility to the need for this in MPS.
Can I add to that?
Yes.
So I just want to stress a really critical point that Deputy Commissioner Weber made, that there is a significant problem of lead poisoning in our city, and that's not known to anybody that's been here for a minute. And our team is really good at following up and finding out where a child is being lead poisoned. So as a parent, to the parents that are listening, please understand that our department takes this very seriously and will follow any lead poisoned child. So as you get your child screened, if they test really high, if they have an abnormal result, our team is committed to working with our clinical partners, which includes Children's Wisconsin and 16th Street Community Health Centers, as they were there at the press conference last week, to help make sure that the kids get connected. There's two parts to this process. There's the children, and then there's the schools. And we have a really good process, and a lot of credit goes to Deputy Commissioner Weber and his team, who have really rebuilt the lead program from where it was years ago. So we are very confident that if we identify more children, we will track those kids down. And as Deputy Commissioner Weber mentioned, we follow families up to 2 years or even beyond to ensure the lead levels go down. So we are committed, and we stand here ready to respond to those kids as we identify them. And we are also working through our legal authority to make sure that MPS rises to the needs of their maintaining their schools and the lead hazards that are present in those schools.
In the last 5 days, have you seen an uptick of families or parents reaching out to the health department to figure out how to get their kids tested for lead?
We had. Yeah. Before I get Tyler, the one part that I was going to mention too is that we've already are starting the planning process to ensure that we can ramp up testing for all of the students affected at the initial schools that we have. And then more broadly, systemically, like 9 months ago, we started working on a process with the Milwaukee Healthcare Partnership to improve lead screening rates within our community. And this really is a call to action to help providers and the hospital systems and pediatricians' offices and parents to make a plan to get your kid tested so that we have better visibility into where lead hazards are in our city so that we can help to mitigate that. As we do the screening, there is going to be a little bit of detective work that happens to look at the current lead level, if there is one present, against the last result of that child. So take me, for example, if I get screened today and my last blood lead level was 5 micrograms per deciliter, and today it's 10 micrograms per deciliter, we're going to start looking into that case to figure out, okay, what is going on with that individual. This will be a system-wide approach. It is not just going to be the health department. As Deputy Commissioner Weber mentioned, we have limited capacity, and we prioritize the children that are at really high levels right now, and we are also prioritizing kids that are already in the abatement process. So we had a meeting yesterday morning already to prioritize the samples for clearances of homes that have kids excluded from their homes right now, to make sure that those families can get back into their home. And those are different circumstances. A residential building is different than you would imagine a school. More time, sleeping in surfaces, eating, the whole shebang. So with that, I don't know, Tyler, if you wanted to add anything else about the screening and,
What about parents reaching out?
yeah, parents reaching out.
Yeah, we have had some parents call and reach us. We've had some parents that we've already engaged with call and ask us if we should be looking in the school. So we are looking at those. We're working with those parents, and we're trying to equip others, partners, FQHCs to also take calls to be prepared for an uptake in testing. And so how can we work collectively to get more children tested and address the concerns of parents? And then just to call out, in our letter we wrote to MPS schools, in that first paragraph, failure to act swiftly and effectively will place children at serious risk of lead poisoning, developmental delays, and other possible health complications. So this is a call to action for MPS, and this is also for MHD. Where can we work faster? Where can we be more transparent? There's a call for parents to, they want to see more of the results. And so we've been working on posting our findings publicly on our webpage. The Cagle School Lead Risk Assessment will be made public. The Maryland School will be made public when we have it. Again, we're conducting that this week, but we're trying to, where can we also just move swiftly and faster in our end to get more information out there. But this is going to be a long road.
What triggers an investigation at another school? Do we have to wait till a child presents with symptoms of lead poisoning and is confirmed to be lead poisoned to get testing done? I know it's a huge process, but can you?
Yeah, that's MHD's process. Ideally, we would live in a world where we don't have to wait. We can get ahead of it because we know where these buildings are. We know where the homes are that are pre-1978. But again, with the burden on the city, some of these homes are falling apart faster than we can fix them. There's been a deep history of redlining in this city that has squeezed economic well-being out of our communities of color. So there's a lot that the parents with lead poison kids are up against, and consequently so are we. So we do have a process at this time of triage of what are the worst cases coming in and how do we get to those as quickly as we can. Often the addresses with the families we work with have more than one child in that home. So if it's terrible and devastating that we have a lead poison child in that home, and the faster we get in, the faster not only can we help that child, but generally other children in that home before they become lead poisoned. So we are in a state of the city where we can't ignore the children that are being lead poisoned, and because of that, the burden takes us from being able to be more proactive than we would collectively like to as a city.
Since this news has been shared publicly, have you seen an uptick at that particular school of more people getting tested and then testing positive for elevated blood?
Yeah, we don't have that data, so we do and we don't. One, MHD does not do lead screening citywide. This is more on primary care, federally qualified health centers. That is mandated by the state and enforced by the state. We are the ones that see those results. We haven't seen a mass influx of test results yet, but we are encouraging parents to get their children tested, especially under 6 or special needs. Again, we're working with partners to see if we can stand up testing clinics, and we'll see what that data will show.
Can you remind us how many children we're talking about that had the elevated blood, and special needs children, the ages and the grades?
That we traditionally see via testing annually,
No,
or
for these particular 3 or 4 schools that we're talking about.
generally it's about, on average, just one child associated with each address that we have a elevated blood level for. I can't go into too much more data on that because of HIPAA, so we have to protect information in that way. So I don't know if I'm answering your question, but generally we have a lead poison child and they have 2 addresses, so each school is associated with one child at this time.
I think I understood the question.
Okay.
So there's 2 children that we've identified are linked to lead poisoning at MPS schools. So the one is for Golda Meir Lower Campus, and the second child is at Cagle Elementary. So we have 2 cases that are linked to those 2 schools. And then we have a third with Maryland and a potential 4th with Trollbridge. Excuse me. And the Maryland and Trowbridge, we're waiting for those results to kind of confirm that there's that association between it. But as Deputy Commissioner was outlining at the onset of the press conference, our process, takes a little bit of time. We have to wait for lead results to come back in. And right now, we have the 2 cases that we've identified. We're waiting on results and testing for 2 additional cases. And then certainly, I think germane to a lot of the questions, and I would suspect a lot of parents are also going to want to know the answer, like, are we seeing an uptick in test results and things like that? As we get that information, we will communicate that back out to the community as well as the media so that folks can keep a pulse on what's happening. This is a really important issue, and as we outlined, our process takes a little bit of time. So we're very soon going to release the results from Kegel Elementary as well, and it's a similar form and function report that says, hey, this is what's going on. The orders will be forthcoming to that school for MPS district to respond to make sure that they're addressing the lead hazards that are outlined in the report. And really think of the report as like a blueprint of where the district needs to focus, and then the orders are saying, hey, you really have to do this.
Can you help me or kind of explain why this is happening now? I mean, lead poisoning for children has been a problem for an extremely long time in Milwaukee, but why now are we seeing it at MPS schools?
So I think it's twofold. As Deputy Commissioner Weber pointed out too, the lead degradation that is present in the schools isn't something that happened overnight. So I think there's definitely a lot of contributing factors that have led us to this point. And then secondly, unfortunately, there's factors to the cases that we cannot disclose because of HIPAA that really present unique circumstances that would put us in this position. So, again, separating the 2 things, there's the school hazards and then there's the children. Children have behavior, as we've noted with the hand-to-mouth behavior, that put them at high risk for lead exposure. And then you have the schools, as we're showing with the photos, that have the degraded paint. And that certainly elevates the level of risk that any child is exposed to. And that's, I think, what I would say. And then Tyler has probably a point.
That's a good question we've been asking ourselves. So one, we looked at our data and do we have previous cases in our current records identifying children poisoned by MPS? We didn't. Doesn't mean it wasn't there, but we did a review of our records. And then it's important to note, like, when you look at these pictures and you see the paint chip and the cracks, that the more of those you have, the more the dust can build up. And so to answer that question, we may need also like MPS's support in answering that question of, has there been a change in recent history of their cleaning practices? Has there been, they have hundreds of kids in each school, so that's a lot of opportunity to chip the paint, and as you're moving, and teachers, as they're moving desks and bookshelves around and putting stuff on the walls, there's just a lot of opportunity for that chipping to happen. So it may not take long for the dust and the hazards to accumulate. So a question is what potentially has changed in recent history with MPS in regards to cleaning and in regards to the maintenance of paint?
While this is new for the health department, clearly there have been cases probably across the U.S. Has the Department of Health been in touch with other city health departments that have dealt with similar situations, maybe Philadelphia, Baltimore, any east side cities that have probably similar instances?
Yeah, we have ongoing conversations with other cities around lead poisoning as a whole, from best practices to use of federal dollars to fund development. One city that we've frequently connected with is Cleveland. We've looked online of potentially other lead hazards in schools online, and then we've also had a lot of consultation with DHS, Department of Health Services. What about statewide? What have you seen? Best practices. And so we've been working closely with them on this, and that we're in a lot of fact finding right now.
You mentioned previously that there are 3 schools where lead wipes have been returned positive. What's the 3rd school?
Maryland.
Maryland?
Yep.
For the 2 students that we know have at Kegel and Boulder, can you quantify how high their blood levels were?
So all I'll say is that in order to become a case elevated blood lead level by state statute, it has to be 1 drop 20 micrograms per deciliter and above. one venous draw, or 2 draws of 15 micrograms per deciliter, I think about 3 to 6 months apart. And so that's when we triggers more authority. Below that level, we still work with children at that level, but it's not necessarily under state statute.
So we can't disclose.
Beyond that, we can't disclose. But that's a general guidance that we follow. But again, we work below those levels, but the higher the lead level, the more we intervene.
When you said there are 1,000 children per year in the city of Milwaukee, is that above the threshold?
That's above 3.5 micrograms per deciliter.
Okay, so that's a lower threshold.
That's a lower threshold. It's a CDC threshold, still considered a lead poisoning, but not at the state statute level for required intervention.
The state statute level is the more extreme cases.
Yes.
I know you mentioned that you guys don't have the capacity or the resources to test every single school right now. Could NPS theoretically take that effort?
There are
on their
private
own?
companies that have lead risk assessors that could be hired out. They have their staff. You don't necessarily need to be a lead risk assessor to identify chip paint or cleanliness, so there's a lot that can be done without having to do a formal lead risk assessment.
They had kind of mentioned that they're following the guidelines from the health department, from you guys. Have you recommended that they go in and look at the other schools?
Or do you want to answer that question?
Yeah, I mean, we're reviewing their lead plan. We're sharing the urgency that they need to maintain these schools, and then we've brought up that they have a lot of buildings pre-1978. And so there's a need to MPS get a grasp on what may or may not be happening in their other schools.
You mentioned that you guys are in conversations with the city attorney about the possibility of closing a year due to these challenges. What does that timeline look like as far as those conversations?
We're going to be hearing from them. That's generally speaking of what is our authority in that space with these buildings. We know, again, we'll be going back on Friday. We know cleaning is happening with the private company starting this week. So we'll have a good grasp already early next week of what's been happening. So we hope the actions we see, we won't have to go that route, but we need to be able to see what our authority is. So we were having conversations as early as this morning, last week, to find out what is our authority, both with at the state level, DHS, and also then with our own city attorney.
That's across the district.
Yep.
Would the options of renovations be possible as well, besides, shutting down a school if it was too costly for MPS? Are renovations possible with the
Yeah,
amount of
there's
lead?
a lot of more simple controls, from painting over the chip surfaces. You can paint it over. Again, that just requires ongoing observation of how that's going, because that can, and then cleaning can provide a significant prevention. So it is challenging getting rid of all of the lead paint. Are you making a building lead free, which could cost hundreds of thousands of dollars, or are you making it lead safe? And lead safe practices can work, but they need ongoing maintenance.
Do you have a sense for how much it would cost to do interim controls versus to fully abate the building?
Good question. And there's nuances to the level of interim controls that you can do, and depending on how you define it. But I don't have an idea of that cost right now. It depends on MPS's contracts and who they have at their fingertips ready to do that.
You mentioned that there are 2 lead risk assessors on MPS's staff currently. When before this last lead risk assessment was the last time that any MPS property had a lead risk assessment?
I don't know. No, I'm not sure.
With proper abatement and cleaning, how long does it take for a lead poisoned child, A, to feel better, symptoms going away, but B, for blood levels to return to normal?
It depends on the case, and that's I think one of the very challenging nuances of lead poisoning and the difficulty and the burden this puts on families. You could have 2 children poison, let's say 5 micrograms per deciliter, and one child you may never see the impacts, and maybe their biology in some way is less impacted by that lead, and another child you could see developmental delays on some level. And so the biology of each child is very different, and that's why it's really important to be so proactive. And then sometimes for some children, from the immediate ingestion could be stomach aches to then reading delays down the road. We don't know. And so that's, honestly, it's very difficult about lead and why it's so important to get ahead of it.
Do you have a sense, I noticed in the report that it sounded like there were no soil samples where lead showed up.
Correct.
Why would that be if there's so much lead, like, in the building and around? And it sounds like on the building. Why would you not have that in areas that children are playing?
That's a good question. It might depend on how close the soil is to the building. Might be if that soil was removed or not over time. It might be, there's a number of factors for that. So, not sure. The biggest concern are the dust wipe samples that have come back. And so it was promising that the soil samples were low, but there's different nuances there. Traditionally in a home, we see the elevated soil samples at the drip line of the house. So again, it depends how close the soil is to the building.
Is there any guidance for teachers? I'm sorry, were you going to say? Go ahead. Okay. Any guidance for teachers who are working in the schools if they want to start removing this dust? Is it safe for them to do? They're older, but yeah, are there any risks? You're doing cleaning.
Yeah, so we're a childhood lead poison prevention program. That's our expertise. There's more data coming out on how lead potentially impacts elders and adults across the lifespan. A lot of empathy for teachers with already just trying to educate the children and now have to be concerned about a safe environment. If they can wipe bookshelves or desks, that can create immediate safety measures and encourage them, and hopefully they can work with the facilities team to work together to make safe classrooms. But recognizing teachers are, they already have a heavy workload.
If lead samples that were this high were found at a child's home, for instance, what would the actions, or what actions would MHD take?
So one would be immediately to get in and clean the property. I mean, we literally will tape up a wall and cracks. Also depends on the conditions of the home. Sometimes when we see lead levels this high, there's other issues with the house, life safety standards, a hole in the roof, a hole in the floor, ceiling issues, plumbing issues, electrical issues. So sometimes we have to, on a combination of challenges, sometimes we have to remove the family from the home. But traditionally, when you have dust wipes like this at this level, you can clean and reduce as quickly as you can. Hand washing can go away, can remove the lead, but it is a concern at the lead levels that we found and really need MPS to clean and take care of that quickly as we can. Normally, we wouldn't be going in to take dust wipes this quickly after an order is in place, but we're taking some on Friday. To see how to move along the progress. We'll be taking more next week, so we want to see progress. We want to see these lead levels coming down.
If you guys are already strapped with staffing to address this challenge, now that we have multiple schools that require more time, more manpower, how are you guys trying to meet that demand or cover that gap?
Yeah, so we've done lead risk assessments now in 2 schools. We're doing Maryland this weekend. We may have to plan a 4th. We're working on overtime with staff. We're including with our lab staff to run samples over the weekend to move it along. We're exploring what capacity does the state lab of hygiene have. We are contemplating requesting, if we need to, help from other jurisdictions or the state to send a lead risk assessor to with us. We're trying to see what we can do to move this work along because we need experienced lead risk assessors working with us. It's one thing to have the lead risk assessment certification. Again, that's on the inspection side. But it's another to have the practice. You can have the certification, but if you're not regular checking buildings, that's an experienced skill set that comes. So we need experienced lead risk assessors to be able to work with us, not somebody that got their certification a year or 2 and haven't done a lot of inspections. So this is an ongoing assessment, an ongoing question we're discussing on a daily basis to see what additional resources we need just to keep up with the schools who are connecting the dot to potential lead poison child.
And so just to be clear too, so last month it was 1 child that seemed to have been poisoned in an MPS school. Now there's definitely 2 and potentially 2 more. So we're looking at 4 kids potentially.
Yes, yes.
The
That's
one
the case.
that's, the one at Cable, I know we can't share so much information, but I know with Golden Meyer, you're always able to share like their grade level or something. Can you share that with Cable?
No, we have to be very careful about protecting that demographic information. The parent can come forward and share, but we have strict HIPAA laws that even giving a insight into a minor behavior of that child could give away who that child is.
And it says in the lead risk report, like, the mean average of 1659, blah, 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 on all window sills.
So the Golda.
Yeah, in Golda, and is that literally like 16 times higher than?
Yes. Yes,
so,
it is.
So we're seeing lead results that are, in some cases, up to 16 times higher than what is recommended?
Correct.
Was there a part of the building, like, I mean, to my eyes, it looks messy and paint is chipping, but to your eyes, was there a particular part of Golda Meir that really stood out to you that was a major issue?
It wasn't initially the bathroom was a concern with the lead paint. That was renovated very quickly, which those pictures aren't here because that renovation happened after we initially found it before this report. I think generally just the amount of chip paint across the entire building is the concern.
Do you have a sense for how long it would take to get to this point with this level of chipping? I mean, it's like 150 photos.
Yeah, we don't know, but probably more than a year.
With the water levels that were published as well, there are a few measurings from bathroom faucets that children are using. For example, the lead level is very high. Were there any like signage? Was there any signage that was
Part of our recommendation is improve signage for MPS on their all faucets.
Were there any signs there that you noticed currently, or are there no signs there?
I'll have to get back to you on that. I know there was generally room for improvement on signage within Golda and their water, but I can't say specifically which ones.
I think we're going to wrap it up. Commissioner, did you have anything else that you wanted to say to finish up?
Sure. Appreciate everyone being here. Obviously, this is a evolving situation, and as we are trying to do, be as transparent as possible as we work through these really complex issues with MPS. Time is of the essence, and we moved really quickly once we identified Golda Meir and now have been obviously tracking other schools. I just want to reiterate again, our process is really thorough and complete, and we are citing HIPAA protections for obviously the parents involved and the kids involved, and we also take our commitment to the children really seriously. This is a complex issue that plagues a lot of families across our city, and obviously MPS is a very large school district, and we stand ready to continue to support everyone throughout this process and giving good information. If folks have concerns or questions right now, these will be on our website. As Caroline has noted, and then there's other information about what you can do in your own home. I live in a home that was built in the early 1900s, and I have young children, so there's simple steps that I do to minimize the risk of lead paint in my own home. So recommend looking at that. We broke it out by the different kind of sections here, and if there are other questions or new developments, we will be really quickly to share that out publicly. So thank you all for being here.